Hello and welcome to this special interview on the occasion of World Kidney Day on awareness of kidney diseases. With me in the studio is Dr. Raghuram Bhat. He's a consultant nephrologist at Victor Hospital's Margao. Dr. Raghuram has done his MBBS and DNB in medicine and then went on to do his DRNB in nephrology. Dr. Raghuram, welcome to the show. Yeah. So doctor, what is the function of the kidney in the human body?
Yeah. As you know, a majority of us have two kidneys.
Right.
And they are the vital organs, and they function 24/7. The main function is throwing out extra water. And the next important thing is, along with this water, waste is also excreted in the urine. Then it maintains electrolytes like sodium, potassium, all those things. Then it has got a important role in maintaining hemoglobin. It secretes a very important organ, erythropoietin.
Right.
And again, calcium and bone health also it takes care.
So these are the normal functions of the kidney. So what affects the kidney and causes it to be in a disease state?
Yeah. So all kidney diseases are not same. There is some entity which happens where kidney fails over few hours. So
Right.
those things are known as acute kidney injury, and those have variable favorable factors. And sometimes kidney fails over a long period of time.
Right.
Those are known as chronic kidney disease.
Kidney diseases.
Yeah. And there is one more entity that falls in between. That is known as rapidly progressive renal failure.
Right.
Yeah.
So just for the viewers' understanding, we can broadly divide kidney diseases into acute, chronic and like long-term standing
Yes,
diseases,
subacute.
or that comes under subacute. So doctor, what is the burden of kidney diseases in India and in our population?
Yeah, nowadays kidney diseases are increasing. So in a recent study, they have mentioned from 11 to 18%.
Right.
So there are certain regions where kidney diseases are more common, like Konkani in Goa.
In Goa.
Yes, and there are other certain parts in India,
Right.
like Uddanam in Andhra Pradesh, in certain parts of Tamil Nadu, so North India.
Where you see a higher prevalence of
Yes,
kidney disease.
there the prevalence of, that means the kidney disease is more common when compared to the other parts of India.
Of the country.
Yes.
Doctor, is there a prevalence of gender or a particular age group where you see a higher incidence of kidney disease than the other age groups or the other genders?
Yes. Due to various factors, males are commonly affected than females.
Right.
And elderly population, they are more prone for kidney diseases, especially chronic kidney disease.
Right.
Yes.
So now going to chronic kidney diseases, what could be the causes that lead to chronic kidney disease?
As of now, there are few important causes like diabetes and hypertension.
Right.
These two are the main causes for kidney diseases. Say you can say around 60%, 2/3 of kidney diseases are because of the diabetes.
Of
yes.
these lifestyle diseases.
Yes, lifestyle diseases, and the incidence of diabetes and hypertension, those are also increasing. So ultimately leading to the rise in chronic kidney diseases. And other factors like obesity, smoking, and if they have any past history of kidney disease,
Right.
any kidney injury, or anyone who is having kidney problem in their family,
like a
those
genetic
are,
incidence.
Yes, those are at risk factor for kidney disease.
Right. Doctor, is there any congenital aspect to kidney disease, like somebody could be born with a diseased kidney or anything like that?
Yes, those are seen in newborns or younger population, and there is a separate entity for that.
Right.
Mentioned at CACUT, congenital anomaly of kidney urinary tract.
Right.
So there are various types: duplex kidney, horseshoe kidney. Horseshoe kidney is very common.
So doctor, what according to you would be the signs and symptoms of chronic kidney disease? Like what would be a presentation a patient would come with?
Yeah. So I visit many places in Goa.
Right.
The people come from Fonda, Vasco, Konkani, and Panjim. So most common the symptoms they present with, like they say pai suzoneta,
Yeah, swelling of the
kaupa
feet.
kai disna, vomiting yeta, and sometimes they say weakness and urinary problems they have. But all these symptoms, they are more common when they enter advanced stage.
Right.
So the problem is at that stage we can continue only the conservative management, and the initial years, the initial early stage of the disease, that is masked, and they do not develop any symptoms during that time. So there the the early checkup, early evaluation, all those things, they
Are
take
very
important role.
important. How does a patient present, sir, in the early stages of kidney disease?
Yeah. So there are 5 stages in chronic kidney diseases,
Right.
starting from stage 1 to stage 5. So depending upon their kidney function, they have graded into this system. So many times, in the early phase of their kidney disease, they may not show any symptoms. So because I visit multiple places in Goa, Fonda, Vasco, Panjim, Konkani, there they present with they say पाय सुजून येता, उलटी करचे अशें दिसता, decreased appetite, uh, weakness. All these symptoms they develop when they enter into later stage.
Later stages.
So it is always better to get diagnosed in the early phase of the disease.
Right. So, doctor, what are the various diagnostic tests you would conduct, on a patient who presents with these symptoms to, finally diagnose whether he has kidney disease or not?
Yes. So the first important thing is urinary test, where many of the health packages, they don't include urine test. They carry their own importance. So the next important test is like routine blood test, where hemoglobin will be checked, renal function, creatinine
Right.
is the important marker. Other tests like cystatin C and electrolyte panel,
Right.
calcium, phosphorus, and ultrasound is also a screening tool to diagnose
To understand
to diagnose the kidney problem.
So, doctor, what are the different treatment modalities that we have for various patients who are suffering from kidney disease?
So the treatment depends mainly on the stages of the
Of the
kidney
disease, yeah.
of the disease. So if patient presents in early stage, sometimes we do renal biopsy to
Right.
diagnose what is the underlying
Cause.
pathology, and then we they'll be put on protective medicines.
Right.
Kidney disease is a progressive one that progresses over a period of time.
Right.
So initial phase of the kidney disease, we can give treatment to slow down the progression, and later stage, when patient enters from stage 5 to ESRD, where ESRD is a state where patient needs renal replacement therapy.
Right.
So there are 3 types of renal replacement therapy. So one is hemodialysis, that is a blood-based therapy, and next is peritoneal dialysis, that is a water-based therapy, and the third important therapy is renal transplant.
Right.
So this renal transplant is mainly suitable and more advisable for younger population.
So, doctor, these are the, as you said, the various methods of treatment in chronic kidney disease. You have dialysis, you have medications. But before a patient reaches to chronic kidney disease or kidney disease for that matter, what we could do to prevent, kidney disease?
There are 8 golden rules to keep kidney disease away. So point number 1 is be active and be fit. Do 30 minutes of exercises every day, and keep your weight under control. And point number 2 is eat healthy and eat fresh. So always avoid salty, oily food and packed food. Those are loaded with preservatives. And always eat fresh. make use of vegetables and avoid red meats, and more important is salt. So 4 to 5 grams of salt is advisable per day. Better to restrict less than that. And point number 3 is keep hydrated. So 2 to 3 liters of water is advisable for any healthy individuals. And if you have any other organ failure like heart failure, kidney failure, any liver failure, then your doctor will advise how much water to drink. Point 4 is check your diabetes regularly and keep that in control. And point 5 is check your blood pressure and keep that in control. Point 6, avoid smoking. And point 7, avoid taking painkillers or any other medication over the counter without any prescription. All those should be avoided. And point 8, as we have discussed, there are high risk groups, high risk factors. Those are diabetes, hypertension, smoking, obesity, any past damage to the kidneys, or if you have any member who is having kidney problems in the family, then check your kidney regularly, because prevention is always better than cure.
So doctor, when you talk about dialysis as a treatment modality for kidney disease, what are the types of dialysis that you offer to patients, and what are the various precautions they need to take when they are on dialysis? Can they lead a normal life, or is there any inhibitions that they have to follow, or restrictions that they need to take care of?
There are multiple types of dialysis. At Victor Hospital, we do acute dialysis. So it's mainly managed by Nephrologist, and this acute dialysis is mainly for critical patients, so who are in ICU, all those patients. And the duration, the type of dialysis differs from the routine dialysis. So here in ICU we do low efficiency dialysis. That's in short form it is known as SLED.
Right.
And the more slower form is known as CRRT, continuous renal replacement therapy.
Right.
And that is available at Victor Hospital ICU. And more, the regular dialysis who need dialysis on long term basis, we usually do 2 to 3 times a week depending upon the patient need. And this dialysis is done for 4 hours.
Right.
And the health advice in this patient is restrict your water intake, especially 800 to 1000 ml per day depending upon your urine output. And always restrict your salt and avoid salty food. And don't miss your dialysis, and take all these medications regularly, and keep checking up all the blood tests. So there are multiple ways to do dialysis. So one is acute dialysis. At Victor Hospital we have SLED, that is low efficiency dialysis, and we also have CRRT, that is continuous renal replacement therapy.
Right.
These two are mainly done for critically ill patients who are admitted in ICU. And besides this, we have Goa's biggest dialysis center. We have 30 beds, which is mainly managed by Nephrologist.
Right.
And it is empaneled with DDSSY. Here we do 2 to 3 times a week dialysis, and for 4 hours. And these dialysis are done mainly for people who require dialysis on a long-term basis. Along with this, I would like to mention some points to the dialysis patients. So one is fluid intake. So please restrict your water to 800 to 1000 ml per day, and restrict your salt intake, and do regular blood checkups, and don't miss dialysis sessions. Otherwise, they develop breathing difficulty, and ultimately they face the complications.
So doctor, there are various myths that we hear about kidney disease, like for example, if a patient who is diabetic or hypertensive, does taking diabetic and hypertensive medications lead to kidney disease? And do these supplements that a lot of boys take when they go to the gym, does that also lead to kidney disease?
Yeah, it's a myth actually. Mainly controlling diabetes and controlling your blood pressure is more important, and these drugs, they help to prevent kidney diseases. So drugs which are there to control your
Control your
sugar
blood.
and blood pressure, those are good for kidneys. So you should not stop that.
So you do more harm by not taking medicines
Yes.
than by taking
Yes.
medicines.
So those health supplements which are given in gym, so it is better to take those supplements under supervision, because all medicines or all supplements may not be good for health,
Right.
because each person is different from another person.
Yes.
Some people might require some multivitamins, some require proteins.
Right. And they should
Uh,
be taken in the right amounts, in
right
recommended
amounts
based
under
on
the,
your body weight
yes,
and all of that.
you need to consult a nutritionist.
Yes.
You need to take advice from a nephrologist, and it is always better to eat fresh and natural things, like
Instead of
egg. If you
processed
want,
foods.
yes, if you want more protein, then you can go for boiled egg, which gives more protein, rather than taking some supplements.
Right. Doctor, many times it is said that if you don't drink sufficient water, you will develop kidney disease. Is that a fact or is it a myth?
Yeah, it is true. If you are a healthy person, it is better to take 2 to 3 liters of water per day to prevent kidney problems. But if you have any end organ damage, that
Right.
means if you have kidney problem, or if you have any heart problem or any liver disease, then it is better to cut down water, as per your doctor's advice.
So, doctor, what would be your take-home message to all our viewers on the occasion of World Kidney Day?
So, World Kidney Day is celebrated mainly to educate the patients, because most of the patients which we see, they present at a later stage. So important thing is to educate the patient and present them early. So the diabetes, hypertension, these two are the main factors which lead to kidney problem, and please control your diabetes and hypertension. So don't wait till you develop signs and symptoms. There, the regular checkup and regular follow-up, they take importance. And 8 golden important points which I have mentioned. One is about the exercise, keeping weight under control, fluid intake, diet, sugar pressure control, stop smoking, and identifying the risk factors. These are the important factors, and that you should keep it in mind.
Dr. Raghu, thank you so much for taking time out and coming to do this interview. And I'm sure you've educated our viewers on the kidney diseases and how to get them treated, and most importantly, the 8 golden rules that we need to follow to maintain, healthy kidneys and not develop kidney disease. I'm sure all the viewers will follow, your advice. Keep watching Prudent. Thank you.